So for men, is it just Botox, or like what other things are they asking for?
All organisms grow breasts, right? In most men, it regresses, but for some guys, it doesn't. So they actually are left with a little bit of breast tissue.
Man boobs,
Man
right?
boobs,
We're talking
right?
about man boobs,
right?
So have you ever had to turn patients away?
As a patient, we've heard of body dysmorphia, where she had issues where she was seeing things very much out of proportion into what the actual physical deformity, so to speak, was.
All right. We're going to get to all of that in just a moment. But first, I want you to know how grateful I am for today's podcast sponsor, my friends at FitAF Nutrition. They are Eastern Pennsylvania's leading meal prep company. FitAF offers meals of multiple sizes for people with various health goals. And you know what I love about this company? They use high-quality ingredients like grass-fed meats, wild fish, and locally harvested produce. And all right, for you parents on the go, they even offer family meals. Go to fitafnutrition.com, place your order by Thursday at midnight, and get fresh, prepared meals delivered right to your door on Sunday.
Use code Leckey20 at checkout to get 20% off your first order of 7 meals or more.
Here we go, buddy.
It's the Ryan Leckey Show.
Welcome back. I am super amped to talk to today's guest because let's face it, if you have lived on social media, I don't know, anytime in the last 10 minutes or 24 hours or like your life, you've probably seen all sorts of little things like here's how to turn back time. Here's what people are doing to improve their look, the glow up, the whole 9 yards. So with us today, a guy who I just think the world of you. I'm super stoked you're here because you're crazy busy. Dr. Chris Sanders, who is the chief of Plastic and Reconstructive Surgery for St. Luke's University Hospital.
Yeah, thanks.
How you do? Are you ready for this?
I'm ready, man.
All right, and just so y'all know, this is the guy who's going to fix my face so I look like I'm 29 all the time. You can do that, right?
Well, you already look 27,
I
so I don't know.
appreciate
I don't want to turn the clock forward,
Thanks,
so
Brotox. All right, so let's dive into this. It's 2025 at the time of our interview. What are the plastic surgery trends? Like, what are people asking for? Because I see all sorts of crazy stuff people are having done, sometimes a little too much on social media. So what do they want?
Yeah, I mean, so, plastic surgery, it's sort of the standards of what's been going on for the past, couple of years. I think the trend towards, non-surgical facial rejuvenation has always been big, and it's just continuing to get more popular. Things like Botox and filler. And there's been things that have kind of come in, the trends, sort of things like we call it here, like the lip flip. It was big for a while, just trying to get a natural appearance. One of my favorite lines is, everyone will notice, but no one will know, right? And that's always the kind of line you have to tiptoe across is you want to make sure that you're getting a result that people are going to notice and people are going to be happy with, and a result that's significant, but it's not something, like you said, that's, kind
people
of
are like, what the heck did you have done?
Exactly.
Because I think, I don't want to say back in the day because people still do that, right? And we're going to dive into like at what point do you tell patients like that's too much and don't put my name on that. But I think, there's some people who have so much done that you're like, holy heck, what happened to you?
Yeah, and we all see the pictures of these celebrities that look great for years and years and years, and then all of a sudden you see
You're
pictures
like,
of
what
them.
the heck? Kenny Rogers, prime example.
Kenny Rogers.
Can I just say Dolly Parton had it right? She's like, you want to do little nips and tucks along the way.
Yep.
And she actually said that. She's like, not like my friend Kenny, who just went in one day and had the whole thing done and tried to turn back like 30 years and he can barely move his mouth. Yeah. All right. And by the way, at the time of filming this with Dr. Chris Sanders, we're dealing with like hurricane force winds outside of our studios. In case you hear anything with the roof, I feel like it's about to blow off. So let's kind of unpack like sort of what you do day to day, because I think obviously your wheelhouse, cosmetic surgery, the whole 9 yards, but a big chunk of your day. You have done so much for breast cancer survivors, right? From reconstructive surgery there, helping, people who come into the ER where their kid's face almost peels off because of an accident and you're kind of reattaching it. Sorry to be gross, but there's a lot you do.
You're right. Yeah, and that's one of the things that I think people, at least certainly in my own experience, didn't even really understand what the full spectrum of plastic surgery really was. And, I always say I do everything, from Botox to butt sores and everything in between. And that's the thing that really has drawn me to the specialty in terms of keeping things interesting, professionally, you never know what's going to come through the door. Whether it's a patient who, just wants to feel a little bit better about themselves and needs, sort of a minor adjustment versus something more dramatic like, a trauma victim or a gunshot victim or a breast cancer survivor. Some along those lines, you never know, from a day-to-day basis what I'm going to be doing, and every day is a little bit different than the day before.
Do you feel, though, I mean, do plastic surgeons in general, like, do they get a bad rap if they're trying to do too much? Like, meaning, like, there's sometimes orthopedic surgeons who are like, oh, I'll do everything from your toes to your hip surgery to this. And someone's like, I just want somebody who specializes in X. So
yeah.
Do you have, like, what's your X?
So I think my X is, I probably do a lot of, body contouring surgery, and that's, both from an aesthetic standpoint, but for also patients who've lost, a significant amount of weight, and, a lot of breast cancer reconstruction as well. One of the things, anecdotes I heard is, like, you ever go to one of these restaurants that the menu is like, 15 pages long, and it's like, probably, not you might not want to get, like, the Clams Casino on a place that's specialized in a lot of stuff as opposed to a place that does just a couple of things really well. I think that's a really good point.
And before we dive into some of the trends, the backstory, how you and I got to know each other, right? You're actually from northeastern Pennsylvania?
I am, yeah.
Talk to me about where you grew up.
So I'm originally from Pottsville, so just down the road.
Vegas!
That's right.
And what happens in Potts Vegas stays in Potts Vegas.
That's right, exactly, in more ways than one. But originally from Pottsville. I did most of my training, in Philadelphia for college and med school. And then I did my plastic surgery training. I tried to get, as far away from Pottsville, both, geographically and culturally, I think. And I went to New Orleans for 3 years, and then came back. My wife's from the area. Our families are still here. Had a good opportunity to come back and do some good work here back in the Northeast. So came back home, and here I am.
Yeah, and you and I met, actually. It was on a morning show segment in my last chapter. That was, what, 12 years ago?
10 years ago?
It was a long time ago. But I remember interviewing you, and I'm like, this guy gets it. He speaks in perfect sound bites. He talks about things that I could understand in, like, middle school terms. So I love that. Let's talk, first of all, I want to go with the big picture around plastic surgery, right? There's a stigma around it. You know what I can't stand sometimes is when people are like, why are you doing anything? Why don't you just age gracefully?
Right.
And getting older is great. Here's what I say. I don't think getting older is great because you're more susceptible to heart disease, right?
Right.
Stroke, everything, and then wrinkles, right? Tack that on there as well. I'm like, I don't want to age. Not only with my face, but with my body, because then you're dealing with all these other health issues. The risk for dementia, Alzheimer's goes up, but I think there is a stigma around cosmetic surgery specifically. So what do you think the big misconception is about plastic surgery that you just wish people would stop believing? What is it?
So I think the biggest one that I always see is that they always, the conception is that plastic surgery is a vanity project, right? And I think it's the exact opposite. From what I find is that patients who come to me, by and large, are always very self-conscious about something. There's something that they don't like about themselves, so much so that they have a difficult time looking in the mirror. And, then they come to me and they talk about it. They talk about something that's oftentimes embarrassing for them. And then I go into great detail, about this, specific thing that they're very self-conscious about. I don't think that that's vanity. I think that there's, something that's actually kind of brave about that. And, I always say that it's very difficult, by and large, for better or for worse, we still always define ourselves in large way by what we see in the mirror. And if you don't like how you look, or if you don't feel good about how the way you present yourself, it's very difficult to find positivity in just about anything else that you do. So I think that's one of the things that I've always said, plastic surgery is not about vanity. Plastic surgery is about feeling good about yourself, and plastic surgery there's nothing wrong in wanting to do something for yourself to make you feel good about yourself, because when you feel good about yourself, you approach the world in a completely different way, I think.
I think the way you show up for yourself and the way you show up for others is totally different.
Right.
And ultimately, it irks me, right? Because you see people, and I'm a big Cher fan, and people are like, oh, and Cher in her plastic surgery, she looks incredible for being in her 70s, right? And it's almost like I'm amazed how much people care about what other people do to their own bodies, right? Like, what's it any of your business if somebody wants to color their hair pink, right? Or if they want to get some implants, or they just want to get an eye lift? Like, why do you care? And sometimes I don't know if you agree with this. I feel as though a lot of people are sometimes so insecure with themselves and they project those insecurities on the other people, right?
Yeah.
And that's why I always say to people, like, if what I'm doing with my life to improve my health, wellness, fitness, maybe it's an eye lift, bothers you so much, that's a you thing, not a me thing.
Right. Yeah. And one of the things I hear so often is, well, I want to get this eye surgery. I want to get, this breast surgery. I want to get liposuction. And my family, my friends tell me, you don't need that. What are you doing that for? I'm like, my first response to that is usually, well, you need new friends, right? Because if they're not going to support you through this, that's a problem. And I think what people are trying to do is they're trying, kind of in a backhanded way to be supportive, to tell the person, well, no, like you're good the way you are, right? But when you hear someone telling me I don't need something, that is kind of trying to twist the knife a little bit to kind of make you feel guilty, right? Because I don't need it, but I want it. And there's nothing wrong with wanting something.
And I think you hit the nail on the head earlier, Chris, when you were saying that it's going to make people feel good about themselves. They're going to show up differently for themselves and for the people they care about and those around them.
Right. Yeah, 100%.
Let's talk about, of course, social media has really influenced beauty standards. I mean, women, men, of course. I mean, I see men struggling with their own body image, right? Because of these fitfluencers, and some people are natural, and other people are juicing, right? I see this going on. But how do you think what's being put out there on social media, how has that kind of changed the patient expectations? Like with their look or with plastic surgery, is it a positive? Is it a negative thing? Is it giving people more ideas on how to tune themselves up?
It's always a double-edged sword, right? Because I think that with social media, the good thing is that, plastic surgery, I think has never been, I don't know that there's ever been more awareness about what plastic surgery is than what it is now. And that's in large part because of social media. I think the downside is there becomes a point where it does promote, I think, a very unrealistic expectation sometimes of what is available. And number one, just what the concept of beauty really is, or what aesthetics are. And I think that, a lot of times there is, unfortunately, I think a lot of one-upsmanship with social media. It's like, I'm going to make my lips look like this. Well, I have to get mine to look like that, but I'm going to get it to look a little bit bigger because I need to get more clicks on my social media page. And a lot of times what is promoted on social media is, not necessarily an idea of, what I would say is aesthetic, right? Aesthetic is an ideal. And some of the things that are promoted is not necessarily anatomically normal, right? Mm-hmm. And some of that is, because of, filters and angles and lighting and all that sort of stuff that, sometimes patients will bring a picture to me like, this is how I want to look. And I'm like, well, number one, you don't look like that. We're going to make you look like the best version of yourself. And number two, that picture is basically a cartoon character at this point, with the different filters. That's and lighting. Future. Right. Yeah. Okay. Well, we can talk later. But, it can be a challenge, understanding what is, number one, achievable and achievable in a safe way. I think those are some of the challenges that social media can pose to, a plastic surgeon and a patient seeking to undergo some different procedures.
And playing off what we said about social media, sometimes impacting beauty standards, et cetera. And it's, as social media grows, technology changes. What has changed with technology in the game with plastic surgery and how it's approached, right? Is it AI? Like, what's being utilized now in the world of plastic and reconstructive surgery?
Yeah, I mean, there's a couple things. I think there's things from a reconstructive standpoint. I think there's also things from an aesthetic standpoint. I think, when we first met, one of the things that I was big into was AI simulations.
It was like, show me your future face.
It was, yeah.
That's
exactly.
like when we met on a morning show. That was like 13 years ago.
Yeah.
Right? Where you're like, this
flies.
is what your face is going to look like after we zhuzh it up a little bit.
Right, yeah. And the technology's only gotten better since then. I think, when we first met, the technology has, this big machine that was probably, as half the size of this room. And now you can kind of do things on your smartphone and show patients, what a realistic expectation for them can be afterwards. From as we continue to improve, as optics improve in the OR, as simulations improve, it gives us the ability to actually almost perform a surgery before I even step in the OR. And that gives me the ability, number one, to make sure it's a safer operation because I'm cutting down time in the OR. I know exactly what I'm doing to meet the patient's expectations. And the patient knows, has a pretty good idea of what they're going to look like, so they have realistic expectations coming out of the OR. there are other things in terms of, monitoring, healing potential and, the ability to look at things in real time and see, like, is this wound going to heal? Is this, breast surgery going to be successful? Is this patient at increased risk for wound healing problems? And what can I do now to prevent problems, down the road? And that's been, a pretty significant shift just in the 10 years or so that I've been doing this.
And you mentioned a big area of focus that keeps you busy, body contouring, right? How has that, I don't know, business spiked with all of these weight loss injections people are getting? Are people coming to you after they've been on weight loss injections, they've lost a ton of weight, and now you're removing skin? Like, what does that look like now with this world?
Yeah, so the trend, we've seen a significant increase in growth in body contouring, just in the past 10 or 15 years, as I think, number one, the weight loss surgery has gotten better from an outcome standpoint and from a risk standpoint. And, these procedures are very safe. They're routinely done. So there was always kind of an upward trend in that because of those surgeries and how safe and effective they've been. And we've just seen an increase in that, probably twofold since, the weight loss drugs have come out. Because there were a lot of patients that might have been afraid to get surgery or not, as well informed as they could have been. And maybe they don't want to undergo surgery, but yeah, sure, they could do a shot once a week. And, seeing that and seeing how effective those weight loss medications are has really, seen an increase in the business of body contouring, so to speak. I think one of the important things is that patients have to understand, though, that this is kind of a tool in their toolbox, so to speak, in terms of overall weight loss, and making sure that they get to a point where not only did they get the weight off, but they can maintain it afterwards.
Yeah, sustainability. I mean, have you not seen 600 Pound Life with Dr. Nell?
Right.
On like TLC,
Yeah.
right? Like
Yeah.
where sometimes people will get like weight loss surgeries, right? And then they're not changing their eating habits,
Right.
and they're like back to square one.
Right.
I want to dive into more. I mean, if you have more to jump in on that,
Yeah.
but you gave me an idea. I got so excited about this. So we talked about, right, with social media and how it's influencing, like with what people are getting done, plastic surgery wise. What is the craziest request that you've ever gotten, I would say, in your career? I mean, you've been a plastic surgeon now for more than a decade.
Yeah.
Like, what's the craziest request either back in the day or lately where you're like, there ain't no way I'm doing that?
The craziest request, I think, I've gotten, it's not necessarily crazy, but a little bit out of the box. I've gotten, requests for calf implants. That was one.
It wasn't me, just in case anyone's wondering.
Well, if it was, I couldn't say
definitely
it's a
wasn't
HIPAA
me.
violation, right? But, so that was a little bit outside the box. I think the craziest thing is sometimes, patients, they come in and it's maybe not weird, right? But it's, I've gotten patients where they come in with a picture of J-Lo and it's like, I want to look like J-Lo. And again, I'm like, oh, you don't really look like J-Lo to start, so you're not going to look like J-Lo afterwards. But I can get you to the point where you're going to be happy with how you look. So, it's always kind of trying to manage that expectation of what is actually well, no, I'll say this. So, I've gotten a couple patients where they wanted, body contouring surgery, but, didn't want a scar. I'm like, well, it's kind of not how it works. We always have to trade, contour for a scar. So luckily, maybe or maybe not, I haven't gotten, those really weird kind of requests that you see on Botched or something like that. It's usually trying to manage expectations versus what's, able to be delivered with surgery.
And with people obviously always looking for deals and the latest and greatest, there's a huge spike in what's billed as medical tourism, right? So this is people traveling to other countries for certain procedures because they're going to save money and they're going to do blah, 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 right? Like the one thing that's marketed, I don't know why, maybe because my hair's thinning in the back, to me all the time are these hair transplants in Turkey,
yeah.
right? But then you also see people flying out of our country for liposuction at a deal. Like, what's your thoughts on that, or things people really need to be aware of?
I think my thought is, number one, don't do it, right? Because, the challenges with medical tourism, number one is you don't know what the quality of person is that you're getting to do the procedure, number one. Number two, the standards of, what training looks like and what the ability to actually be able to perform some of these procedures is. In some of these other countries, to say it's substandard is, I think, would be an understatement. Sometimes there is no standard, and sometimes the person that you're getting surgery on, probably almost assuredly isn't a plastic surgeon. It might not even be a surgeon. I've seen horror stories of patients who go to Mexico to get breast augmentation, at some village because they think they're going to save, a couple $1,000 or a couple $100, and then they come back with horrible infections and complications. And
these are people you've had to fix.
These are people that I've had to fix, and they've come back and had, significant deformities and issues and complications and time away from their family and work. So I think the most important thing for people to understand is that, just because something is cheaper doesn't mean that the quality is there. It's like anything in life. Sometimes the cheaper option is not necessarily the best option. And if you're going to do anything for your body, you want to make sure that you're doing it in the most safe and quality environment that you can possibly find, and make sure that the person, no matter where you're going, if it's here in Pennsylvania, make sure that the person you're seeing is qualified and has the credentials to do what they're advertising that they can do for you.
Yeah, because I think plastic surgery is not only, it's artistic, but there's also science behind it. Is that what kind of drew you to it? I mean, more of the sciencey side, because a lot of people think like, oh, you just want to do like brow lifts all day, but there's a lot more to it.
There is, and I think, one of the things that always sort of surprised me about plastic surgery is that, there is an art form to it, I think, and the art is kind of the subjective ideal of, what is, aesthetically pleasing. But I think one of the things that always surprised me is how much more like, I think, architecture it actually is, where you're looking at ratios and proportions, and there's a certain degree of math that sometimes will go into it, and that's the thing that I think is some of the underpinning currents of plastic surgery. Whereas it looks easy, that's why some people in the Dominican Republic think that they can do a tummy tuck just because they've watched a couple videos, but there is a lot of underlying principles that are very important to the practice of plastic surgery that might not be apparent kind of on the surface.
But also ethics with plastic surgery. So have you ever had to turn patients away?
Yeah, and
what do those conversations look like?
It's difficult sometimes because there's one patient I remember in particular, very early in my training, where a girl came in and she was in her late 20s. Beautiful girl, in shape, and wanted a tummy tuck, and she was just not a candidate for a tummy tuck. She had, maybe 3 pounds to lose, right? And just in the consult process, it sort of came out that there was something else going on with her, in her life and her social situation that was not going to be fixed by plastic surgery. As a patient, we've heard of body dysmorphia, where she had issues where she was seeing things very much out of proportion into what the actual physical deformity, so to speak, was. And trying to get a patient, I think, to understand that is sometimes challenging because they come in with an expectation that, I'm going to the surgeon, I'm going to get surgery. I always say you go to the barber, you're going to get a haircut, right? And, trying to help them get to a point where they understand I want what's best for them and what's going to be the safest thing for them, and sometimes not operating on a patient is the best thing and the safest thing for them.
Because I think out of probably all surgeries, right, plastic surgery plays such a role and has an impact on mental health, right? So some people come, like you said, you had this person, you're like, if it's just 3 pounds you need to lose, you don't need surgery, right? How do you navigate that with somebody? Because I feel like there are those people who, no matter how much work they have done, right, they're never going to be happy. And maybe it's not a body thing, maybe it's more of a mind thing.
Yeah, and that's, a lot of plastic surgery is playing psychologist and sometimes psychiatrist, in the preoperative consultation process, and making sure that, that the patient is entering the surgery from a good place, making sure that they're, physically and emotionally ready for some of the changes that they're going to see afterwards. Sometimes that can be very challenging, particularly for body contouring patients where, they have lived, their entire life, struggling with weight and struggling with body image. And, if they're not entering, the next step in a good place, sometimes that can be very challenging because then they can get very hung up on, I don't want to say insignificant changes, right? But like they gain 3 pounds on the scale, it's the end of the world to them, or their scar, healed a little bit differently on one side, and they can get fixated on things, and it's not because they're trying to be picky. It's because that they might not be willing to accept a different body image for themselves because they're not used to, having a positive image of themselves, and trying to get to that to a place can be somewhat challenging sometimes.
What's the amount of men you're seeing for plastic surgery, and what are they asking for?
It's certainly increased, in the past, several years or so, and I think that's because, again, there's a more acceptance for men to get plastic surgery. The thing that I see the most for men is things like Botox, and it's its sort of counterparts in non-surgical facial rejuvenation. That is, it's actually always one of my favorite things to do, because I always say I'm not only a spokesman, I'm also a client, right? Because a lot of guys come in and they're a little bit embarrassed, or they don't want to admit to their friends that
I'm always amazed by that, because I'm always like, yeah, I had Botox, I just got filler in my jawline, like. I tell people everything, right?
Yeah.
But there's some people who are still like, oh my gosh, don't say anything. But that's what I like about your approach, right? I think that's a goal, and I think that's what we're seeing a lot in 2025 with trends, is where people want to enhance somebody's natural beauty and not make them look like they're like just lick their lips and stick them in the back of a car like Garfield, right? Like,
right.
You know what I mean?
Yeah.
But so for men, is it just Botox, or like what other things are they asking for?
There's also a significant increase, I think, in body contouring, and not traditionally like tummy tucks and all that kind of stuff, because a lot of the changes that we see for that are post-pregnancy type changes, but there is an increase in things like liposuction and some non-surgical body contouring, like things like cool sculpting and that sort of thing. One of the things that has really sort of increased in the past couple of years, and I think it's because of an increased awareness of it, and I think maybe patients aren't as embarrassed to seek it out, as gynecomastia, which is actually breast tissue in men. And what
what, to build pecs, or what do you mean by
well,
that?
no, not necessarily to build pecs. It's just that they actually, we all, when we're exposed, to estrogen when we're in mom's belly, all organisms grow breasts, right? In most men, it regresses, but for some guys, it doesn't. So they actually are left with a little bit of breast tissue.
Man boobs, right? We're talking about man boobs,
right? So, what I find is that, I'll have guys who come and they're, super physically fit, and, their
diet,
pecs
their
are juiced,
exercise
they're
on
doing
point,
everything,
yeah.
and they're like, I can't get rid of this tissue, and I'm really self-conscious about it. And I have to tell them, it's like, well, it's because it's not actually fat. You actually have breast tissue, and it's nothing to be ashamed of, right? We all have it to a certain degree. It's just that in your particular case, it didn't go away, the way it does in most guys. So that's typically treated with a combination of either a liposuction or sometimes making a small incision to sort of get that tissue out. But for some guys, it's something that can be, life-changing, because they've been teased about it their whole life, or that's the thing that led them to get very physically fit, and the thing that they are most self-conscious about, that put them on the journey to to get juiced up and to get pecs. They're still having problems with that because they don't really understand what the underlying condition actually is. So small surgery that can be an hour and a half for some guys can be very life-changing. It's just that they don't know what the actual issue is, or what what the remedies for it are.
And I think what's interesting, right? I mean, forever people think plastic surgery, they think breast implants, et cetera, right? But are people getting more surgeries south of the border, down there, for rejuvenation, or for guys to improve like their look? Like, what are you seeing with all of that?
In terms of, there is things like vaginal rejuvenation, again, particularly for women. We see it commonly after childbirth, and, things can get very uncomfortable, actually, down there for that. And they have issues, just on a daily functional basis. And it's not, necessarily, again, it's not a vanity thing. It's not, anything in terms of, sexual, desirability. It's actually, you can become very uncomfortable and sometimes even painful. And then, again, I think the, stigma, to something like that is, when we talk about things that are taboo in plastic surgery, that's probably one of the things that's most taboo. There's really nothing to be embarrassed about when it comes.
And you
to
have to
those things.
find a doctor like Dr. Chris Sanders, who you can just open up about anything. I remember the first time I met you, we met for like 5 minutes. I'm like, all right, I got to tell you my life story. I have a question. Would this be considered plastic surgery? And there's the hurricane force winds again, by the way. We're good. We're not going to blow out of here. But I think that's really great. And I think a lot of patients, because I've known, and I want to point out too, that while you do cosmetic surgery, right? I know a lot of people who've had incredible results from reconstructive surgery, right? People who've gone through incredible battles with breast cancer, and you kind of help give them, their life back in a way where they can feel really good about themselves.
Right.
So I think that's amazing. And I remember how many, gosh, knowing you over the years, there was times you're getting called into the ER to help fix somebody's face, right?
Yeah.
That was in a really bad car accident. And
Yeah.
you do a lot of that still.
Yeah, we do a lot of that. That's the part of plastic surgery that I think that, I don't know if it doesn't necessarily doesn't get pressed, but it certainly doesn't get as much. And that's the part that I, going through my journey, I kind of didn't really realize that was as big a part of the practice of plastic surgery as it is. And to be honest, that's probably part of my job that I think is the most rewarding, in the sense that, we always say plastic surgery is the specialty of form and function, right? And those two things are very interconnected. But particularly when a patient undergoes something like breast cancer, or undergoes a significant trauma, not only is their form changed, but their ability to function, in society is changed. And I don't just mean like the ability to go out in public. I mean, sometimes they have a very bad hand injury, or a very bad, chest injury, that they literally can't function. They can't hold a pen properly. They can't, hold a spoon. And those instances where you're using sort of the plastic surgery principles to restore function or restore form, kind of gives patients the sense that they're getting something back that's been taken from them, which is a little bit, I think, different sometimes. In some ways unique to plastic surgery, because a lot of things in surgery, we're taking away a disease process, where in plastic surgery we're trying to restore natural form, which is a little bit different and pretty rewarding.
And as you mentioned, right, that's a part of plastic surgery that doesn't get a lot of buzz.
Yeah.
Right. It's the fact of helping people get their lives back. Is that something you're passionate about? Like, you're leading the whole new team of a residency program at St. Luke's, right? A plastic surgery residency program. Is that like one of your big focuses, to expose people to all of this, including a lot of that?
Yeah, so education has always been one of the things I've sort of been most passionate about in terms of my medical career. And teaching, I think there's so many benefits into teaching. Number one, it just kind of keeps you on your toes, because I have to know what I'm talking about if I'm able to kind of teach it to the next generation. But I think making sure that we are staying cutting edge, I think, is always important. And in plastic surgery, we always have to come up with new and exciting things to move the specialty forward, because a lot of stuff that we have done kind of ends up getting co-opted by other specialties, and things like Botox, or things like hand surgery, things like rhinoplasties have been absorbed these days by other specialties, and I think sometimes rightfully so. But we always have to continue to find a way to be relevant. I certainly think teaching and making sure that the next generation knows what's going on, I think, is a big part of that. I think also, part of having, residents, particularly in this area, particularly in plastic surgery, I think, number one, attracts, plastic surgeons to the program that, are from other areas, or from, quote unquote, the bigger programs from the big cities, and coming, to be able to teach is always important. To have surgeons with a particular skill set, be attractive to come and practice in the area. And I think, coupled with that is keeping plastic surgeons in the area. You're very much more likely to do residency either where you grew up, or, to practice medicine either where you grew up or where you actually did residency. So in this area, I think that there is, in the upcoming years, I think, going to be a significant vacuum in the sense of what we need in terms of the specialty and what the population is able to get access to.
And you talk about continuously moving the needle forward with the field of plastic surgery. So thinking of that, what has changed even with, like, I don't know, an eye lift or certain things that used to have people laid up for days? What's changed with technology and how you've moved things forward to kind of get people in for surgery and out? Like, are things more like, hey, you're released that day? Like, what's the biggest notice you've seen? Yeah,
so I think, there's in terms of surgical technique, there's always a move to be as more minimally invasive as you can be. And minimally invasive doesn't necessarily mean it's a small surgery. I always say liposuction is a minimally invasive surgery, but it's actually, bigger on the scale of, the significance and the recovery time. So I think that there's always a trend to try to get patients as little surgery as they possibly need to get them the result that they want, because the recovery time ends up being a little bit better. I think technology has certainly improved in terms of assessing and being able to make decisions intraoperatively, in terms of cutting down on the decision making process for things like specialized CAT scans that we're getting, or things like we talked about way back when with the surgical simulations. I think one of the things that has been pretty significant in terms of the past 10 or 15 years or so has just been our ability to manage pain better with some of the differences in medications and some of the longer acting local anesthetics that we can use, to the point where I used to do a tummy tuck procedure that sometimes a patient would end up staying overnight. Now they're going home the same day. They're coming back to my office a couple days later, feeling like they didn't have surgery, and they're up and they're moving around, and doing so allows them to feel better quicker and get better quicker, because they're up, they're moving, they're working out the anesthesia, their muscles aren't so tight, they're not just sitting around feeling like crap, and sick and nauseated because of the different medications that we're giving them. So the outcomes tend to be better because of the way that we're able to manage things from a pain standpoint afterwards, actually.
Let's take a face and a neck lift from, say, 13 years ago.
Yeah.
What that downtime and what that surgery looked like compared to today in 2025.
Yeah, so, in that time frame, that has gone from a surgery that was typically done almost always under general anesthesia, coming with that has a significant amount of bruising and swelling. Downtime was pretty significant. Blood loss may have been an issue. Nowadays, depending on certain techniques that you're doing, you can actually do a facelift with local anesthesia, where patients awake and
awake while you're like peeling their face off.
Yeah, believe it or not, they have some good drugs on board, but they're awake.
Might be like, you need to knock me out. I do not want to see that.
But in doing so, the blood pressure is much better controlled. They're not getting as much IV fluid, so the swelling and all that kind of stuff is down. So their bruising is a lot better, their swelling is a lot better. Their pain control actually can sometimes be a little bit better, managed post-operatively. So the results we see a lot quicker. And again, it's just, not the least invasive way. Oftentimes can be a better way to get the patient recovered quicker. So if you can do a procedure with local anesthesia for the right patient, right? They have to be a patient that's able to tolerate it and able to stay still for an extended period of time. But for the right patient, being able to do a facelift under local anesthesia, they get to see the results much quicker. Their pain is a little bit better. They don't have as much bruising and swelling, and it's actually a procedure that's a little bit easier to recover from.
So we talk about the advancements with the technology with the face and neck lift, right? And how things have moved ahead. Has it changed the price of this stuff? Like, I don't know, 13 years ago, a facelift or breast implants were $40K, now they're $20. Like, where are we?
Yeah, so, from a cost standpoint, and that's one of the things that, as technology improves and as we can, better serve these patients in a safe environment and do so, number one, it has to be the right environment and it has to be done in a safe way. But if you can cut down the cost of, taking a patient that you might have had to take, to the operating room in the hospital and spend, a night or two in the hospital versus making that now a same day surgery, or actually sometimes even be able to do it in the office, under the right circumstances.
So give me a then and now. What would we look price tag wise on a surgery? Approximate. And I know everybody's different. It's a case-by-case basis.
Right. So there are things, it wouldn't be unheard of, a couple of years ago for facelift, I would say to be, $20,000, and maybe now it's, half that or sometimes even less than half that, depending on.
That's worth $10K.
So,
yeah.
And again, it's all about making, but you also have to couple that with making sure you're doing it in the right environment, making sure it's safe and making sure it's a quality environment, which, goes to medical tourism. Right? You might be able to go to Miami and a guy's going to say, yeah, come down and I'll do your facelift in your office. Number one, that guy might not be doing what is actually the standard type of procedure. He's doing it cheaper, but he might not be doing it the right way. So it's always important to, manage costs with the expectation of making sure that this surgery is going to be something that is going to meet your expectations, make sure it's going to be safe, and make sure it's done in a quality and safe environment.
All right, and before we wrap up, what are the questions people should be asking around when picking a plastic surgeon And the question to ask your doctor before you have surgery.
Yeah. So I think number one is, one of the, I hate this question, but I think it's a good question. Is like, well, how many of these have you done? Right. And to which I usually say, well, I stopped counting a couple thousand ago. But, I think what the real point of that question is are you qualified to be doing the procedures that you're doing? And that makes sure that the person is qualified both from, an experience level, but also from a training level. And I think that that's one of the big differences and one of the really important factors when you hear about a quote unquote cosmetic surgeon versus a plastic surgeon. A cosmetic surgeon, there is really no such thing as a cosmetic surgeon. There might be a plastic surgeon who specializes in cosmetic or aesthetic surgery, but the Board of Cosmetic Surgery isn't really recognized by the American Board of Medical Specialties. So I think making sure that the person that you are doing or going to, who's doing your procedure, knows, number one, that they've had, the appropriate training, that they had the appropriate experience, and also that they can manage complications in the appropriate way. And I think that, and those things, I think, are, paramount to making sure that the person that you're going to can deliver, from their surgical standpoint, what your expectations are from the surgery itself.
And what's the question they should be asking before any type of plastic surgery?
I think, if there's one question, I think making sure that they would understand, what the risks are of the surgery. We all want to make sure that, okay, well, if everything goes right, what's the best outcome, right? But it's also making sure to be well informed that you understand what the actual risk of a procedure is, because that's really gets to the heart of what informed consent is for surgery, and making sure, like I said before, making sure you're entering surgery in the right frame of mind. It means making sure you understand what the best case scenario is, but also making sure what the risks are, and making sure you're willing to accept, facing those risks in a reasonable manner.
And I'm sure you get this question all the time when people find out you're into plastic and reconstructive surgery. Do they look at you and say, "Oh, what would you do to my face?"
Yeah.
So go ahead, Chris. Go ahead.
Listen,
What would you do?
Ryan, you're a beautiful man. I don't know that I could improve on that, but
You have to get that question, I'm sure, at holiday parties and other stuff. How do you answer that? Especially if they look like Shrek.
Right. It's a blessing and a curse, sort of being able to, people are always like, oh, are you always assessing people, or, and I try not to, especially with friends and family, but there's a lot of times where, I'll be in a crowded area and I'm like, that person's had some work, and maybe not the best work either. But, one of the things that, my punt on that question is like, well, just come to the office, we'll talk about it. That way I don't put people on the spot, in a crowded public place.
All right. Anything you want to add that I did not ask you? I mean, you are the chief of plastic and reconstructive surgery at St. Luke's University Hospital. Anything you want people to know?
Well, no. I mean, I think that one of the things I want people to know. Well, there's two things. I think there is sometimes a thought that there's not. I understand maybe that there's not, but that you have to go to a big city to get good quality plastic surgery, and that's not necessarily the case, because you always hear, oh, I'm going to go to Beverly Hills, or I'm going to go to New York, or I'm going to go to L.A. And there are the plastic surgeons out there, by and large, for the most part, unless there's someone who's really well renowned and well known in a certain area, they're not necessarily doing anything there that we don't have available here. The plastic surgeons, particularly at St. Luke's, we're all very well trained. We have extensive experience in all types of plastic surgery, and you're going to get as good a result here as you can anywhere in the country. I'm fully confident of saying that without any reservations. And just the other thing I want to say, thanks to you, man. Like, you've been, a big,
I've always been a huge fan of yours. Yeah. And I mean, I want to say you're a busy guy. Not only are you running that department, I mean, you have 2 kids.
Yep. 2 little boys.
I mean, I love your family, your wife. You guys are all great. And I'm amazed how you juggle it all. And sometimes at one point, I know you were like so busy. I'm glad we connected. I was like, did this guy change his cell phone? And then I talked to your wife and you're like, no, he's like in surgery, like helping people for like 18 hours a day. No.
Yeah. No, it's busy, but you've been a great friend to me throughout my career, and I appreciate having you have me come and talk a little bit and give me the opportunity to educate people about plastic surgery. So I appreciate you, man. I appreciate being here, and thanks for all the help that you've given me throughout my career.
I love it. And the last thing I'll say, is it like a requirement if you work in a plastic surgeon's office to have a lot of work done? Do you ever walk into I've walked into some places and I'm like, what happened to you?
Yeah, it's you have to. I always say I'm not only a spokesman, I'm also a client, right? I always say I have to be empathetic to my patient so I understand what they're going through. So I think dipping tasting your own medicine, I think is helpful in some respects, but
as long as it enhances the natural beauty, right?
Exactly. There does come a point where I think if you walked into a plastic surgeon's office where looking at the staff might make you think about picking someone else.
It's like, whoosh, hi, I'm a red flag.
Right, yeah, exactly.
Right.
So,
You're the man. Hey, this was eye-opening, informative. It's really cool just to see, obviously, even from when I met you, 13 years ago, and to see the change and the growth and the innovation, and even to what you're doing for Northeastern Pennsylvania, right? To be able to create a plastic surgery residency program at St. Luke's, working on that.
Yeah.
I think it's great because you hit the nail on the head. I think a lot of time people think they have to leave our area or certain places, right, to get great care, and you got to go to Beverly Hills but you do a same facelift right here.
Yep. Again, the quality of plastic surgery that is being done here in this area is second to none, worldwide. And again, I say that without any reservation.
All right, rock on. Dr. Christopher Sanders, originally from Pottsville, Pennsylvania,
Pottsville.
a.k.a. Potts Vegas.
That's right.
Back in the area doing big things. But thanks so much. I know there's a lot of people whose lives you've changed for the better. I know family members have gone. You're the best, so thank you.
Appreciate that, man.
And maybe I'll be a patient down the road a little. All right, thanks so much. And thank you for being a part of another episode of The Ryan Leckey Show. I'll see you next time.
Here we go, buddy.